Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're cracking a bit of a medical mystery. You know, this is one of those classic cases of deduction, where just a handful of symptoms can point to one single, very precise culprit. So let's get into it and investigate the case of the weakened grip. So I want you to imagine something. Let's say you're a mechanic, right? Your hands, they're your entire livelihood. They diagnose, they fix, they build. But what happens when, day by day, that strength just vanishes and your grip starts to fail? That is the puzzle we are solving today.
Okay, let's meet our patient. We're talking about a 34-year-old guy, a right-handed mechanic, and he comes in with this progressive and frankly pretty worrying weakness that's taking over his dominant hand. So here are the initial clues right off the bat. His job, it involves this very specific repetitive motion, twisting his forearm back and forth, exactly like using a screwdriver over and over again. And the initial exam, it zeroes right in on the problem. He can't extend his fingers and thumb. Now, this isn't some general all-over weakness. Nope. It is super specific, and that's our first big clue.
All right, this is where the real detective work begins. The physical exam, that's basically our crime scene, and every single finding is a piece of evidence. So let's break down exactly what the doctors found. The very first question any neurologist is going to ask is a big one. It's this: can the patient feel things normally, or is the problem strictly with moving things? Just answering this one question can literally cut our list of suspects in half. And here's our answer. His sensation is totally normal. He can feel touch everywhere, no problem. The issue is purely motor, just that specific weakness when he tries to extend his fingers and thumb. So what does that tell us? It tells us we're hunting for a problem that only messes with the motor nerves and leaves the sensory ones alone. Okay, let's recap the evidence so far. 1, we've got a purely motor problem. 2, it's only affecting the muscles that straighten the fingers and thumb. But here's a really critical detail. His triceps muscle, the one that straightens the elbow, it's perfectly strong. And that tells us the injury isn't way up high in his arm. No, it's got to be somewhere further down the line. So right away, we can rule out a major injury to the main nerve trunk up in his shoulder or upper arm. That's not it. Our culprit is way more subtle, hiding somewhere after the nerve has already sent off that branch to the triceps. To find it, well, we're going to need a map. Okay, time to pull out our anatomical map. We are going to trace the entire path of our prime suspect here, the radial nerve. Think of it as the master controller for all the extensor muscles in the arm and hand.
I want you to think of the radial nerve like a big old electrical cable. It starts up in the neck, travels all the way down the back of the arm, and it's sending out smaller wires to different muscles along the way. Our job is to find the exact spot where there's a short in that circuit. So the nerve's journey is actually pretty direct for the most part. It starts in the neck, runs down the arm, and then, right around the outside of the elbow, it hits this really critical fork in the road. And there, it splits into 2 main branches that have very, very different jobs. And this is that fork in the road. One branch, called the superficial branch, is all about sensation on the back of the hand. The other one, the deep branch, that one's all about movement. It's the one controlling the muscles that extend the wrist and fingers. Now, remember our biggest clue? No sensory loss. That tells us the superficial branch is totally fine. Our culprit has to be somewhere along the path of that deep, motor-only branch. We're getting close. Okay, this is it. The moment of truth. We've got our clues, we've got our map. Let's put them together and zero in on the exact location of this injury. So that deep motor branch, once it passes through a particular muscle, it gets a new specific name, the posterior interosseous nerve, or PIN for short. And just look at its job description. It's purely motor, and it controls finger and thumb extension. Come on, that is a perfect match for our patient's symptoms. Now, here is the kicker. Here is the pinch point. For that nerve to become the pin, it has to squeeze through this muscular tunnel called the supinator muscle. And this spot, it's a notorious place for nerve compression. And why? Well, what does the supinator muscle do? It twists the forearm, the exact motion our mechanic does all day long with that screwdriver. So that constant, repetitive twisting can irritate and literally compress the nerve right at this very vulnerable spot. And what's the result of that very specific pinch? A condition called finger drop. See, he can't straighten his fingers,
but his wrist is fine and his sensation is totally normal. Every single clue we gathered now points to this one single precise location. The symptoms, they match the anatomy perfectly. Case closed. Almost.
But, a good detective always confirms their theory by ruling out the other suspects. So let's just take a quick look at other common nerve injuries to see why they just don't fit this case at all. Okay, so what if the injury was higher up, from something like crutches or a broken arm? Well, that would cause both wrist drop and sensory loss. Our patient has neither of those, so that's out. What about carpal tunnel? Well, that's a completely different nerve, and it comes with that classic numbness. Again, doesn't fit. See, none of these other suspects match the evidence. We've definitely found our culprit. And so it all comes down to this one single, elegant summary. This sentence right here, it just perfectly encapsulates the entire mystery. The exact location, the specific cause, and that precise set of symptoms. By carefully following the anatomical clues step by step, we have solved the case of the weakened grip.